How to identify HIV symptoms in men. Hello, this is Mark Medicals with the latest on HIV cure news, HIV treatment, and ways HIV is transmitted. In this video, I will tell you about the following. 1. HIV symptoms in men, early signs. 2. What are HIV-AIDS signs and symptoms? 3. How do you know if a guy has HIV? 4. How do you treat HIV symptoms? Alright, let us get started now and answer those questions for you. 1. HIV symptoms in men, early signs. Guys, you well know that you still have a high chance of eliminating HIV soon within 72 hours after risky exposure. If you take HIV treatment called HIV PEP medicines as soon as after exposure, research has shown that you have more than a 90% chance of not getting infected, meaning that permanent HIV infection occurs after 3 days. So, after permanent infection, it takes about 1 to 2 weeks for your body to recognize the virus and start reacting or adjusting to it. As your body adjusts itself to the virus, research has shown that 40 to 90% of people will experience acute retroviral symptoms which mimic bad flu. Symptoms that show up in the first month of infection include fever, sore throat, body rash, cough, diarrhea, night sweats, fatigue, and others. In men, fatigue and other effects of HIV on your body could result in erectile dysfunction or less libido. But, as you can see, 10 to 40% of you may not see any symptoms till the late stage when you have advanced to the AIDS stage. Since HIV-negative people too have a risk of experiencing the same symptoms from flu and other infections, you cannot use symptoms to tell if you have HIV or not. The only way to know if you have the virus or not is by taking an HIV test. 2. What are HIV-AIDS signs and symptoms? Hope you know HIV and AIDS are different. HIV attacks and destroys cells of your immune system called CD4 cells, leading to AIDS. After the first 30 days of exposure and infection, you will start the chronic stage of HIV infection where you will have no symptoms till many years ahead when your immunity goes down due to the virus. It usually takes you 5 to 15 years to advance to the AIDS stage when your CD4 cell counts fall below 200. Some of the signs and symptoms of AIDS in men include recurrent skin diseases including body rashes, unexplained persistent fevers, rapid weight loss leading to wasting syndrome, persistent diarrhea, TB infection, HIV-related mental disease, and many others. Still, those mentioned signs and symptoms will not tell if you are living with HIV or not unless you go for HIV testing. 3. How do you know if a guy has HIV? Or how to identify HIV symptoms in men? Most men living with HIV have sores in their mouth, anus, or genitals. They also experience fever or intense night sweats that don't go away, and memory problems. You could also have blotches on or under the skin that are red, brown, pink, or purple. Other signs that point to an HIV infection in men include recurrent body rash or skin spots, an enlarged neck, armpit, or groin, visible lymph nodes. You will need an HIV test to confirm if the above-mentioned signs and symptoms truly are due to underlying HIV infection. 4. How do you treat HIV-AIDS symptoms? Early HIV symptoms may not need any treatment unless the symptoms are severe or worsens. Common over-the-counter medications like paracetamol, antihistamines, and simple steroids should be able to help, but if symptoms persist, we advise you to see your doctor for proper diagnosis and management. Most early HIV symptoms usually disappear on their own after 1 to 2 weeks, and thereafter you will have few or no symptoms till the time your CD4 cell counts are low or below 500. On the other hand, AIDS is hard to treat unless you get started on HIV treatment called antiretroviral therapy. ARVs help to clear HIV from your blood, thus helping in restoring your body's immunity. People living with HIV who are taking their ARVs have the same life expectancy as their HIV-negative counterparts. Common HIV treatments today include regimens that constitute of tenofovir, lamivudine, dolutegravir, bictegravir, emtricitabine, and other injectable HIV treatment like cabenuva and lenacapavir.